Knock, knock, knock. Good morning. My name is Margaret. I'm a nurse for Kaiser University, and I'm here to check your central line and the dressing. I have washed my hands at the sink and provided for privacy. I will now perform hand hygiene at the bedside. I'm checking the patient's identification. Can you tell me your name? Patient says Evelyn Cooper. Can you tell me your date of birth? 11/15/71. Well, it's a pleasure meeting you, Miss Cooper. And can you tell me if you have any allergies? You do? Yes? I see you have a ban to iodine. Well, we won't be using any iodine today then. Okay, I'm going to go ahead and raise the bed and inspect your central line and the dressing. This should not be painful in any way, Mrs. Cooper. Down. Okay, I'm looking at the central line dressing, and I'm determining if it's time for us to change that. We'll change the dressing if it's visibly soiled, damaged in any way, or outdated or per hospital protocol. I see that your dressing is outdated, and therefore I'm going to go ahead and change it. Okay, let's check the end of the tips to make sure that they're all clear and no signs of infection. Alrighty, so what I'm going to do is gather my supplies for a dressing change. It shouldn't be uncomfortable. There'll just be a little tugging on your area, your skin area, where the sticky stuff is. It should last about 5 or 10 minutes, and let me know if you feel any uncomfortableness. Okay? Thank you. Patient verbalized understanding. I will now remove these gloves, perform hand hygiene. Bring my supplies, which I have a central line dressing change kit with a bio patch inside and a mask for the client. Miss Cooper, I'm going to put a mask on your face, and I'm going to be wearing one too, so as if we don't accidentally contaminate the area underneath the dressing. So I'm going to put it on you and ask you to turn your head to the side as well. Is that okay, Mrs. Cooper? Patient verbalized understanding. I can open my dressing change kit now, peeling it away, take out the inside package, and throw the outer package away. I can open the first flap to expose the mask and put it on me. I will now remove the soiled dressing. I'm going to pull it away from the insertion site so as not to pull the catheter out accidentally. Doing okay, Mrs. Cooper? Patient said yes. Well, it's in pretty good condition. I'm stabilizing the catheter with my fingers. I remove gloves, perform hand hygiene. And make sure when I'm opening the kit that I'm not doing any contamination. The first thing I see is my sterile gloves. I put them to the side. I will open my package to create my sterile field. My bio patch is inside. Now, I will open my sterile gloves. How you doing, Miss Cooper? Patient said she's doing fine. It'll be just a few minutes longer, ma'am. I will now put on my sterile gloves. I'm going to cleanse the area with chlorhexidine or alcohol and not use iodine. You're going to feel a little cold. I will first cleanse around the immediate insertion site. Around that area, not going back over my first area for number 2. And number 3, a wider circle, and down the tubing to include the ends. I am now allowing the area to air dry. The area is dry. I'm applying the bio patch with the blue sky up. How you doing, Miss Cooper? Patient reports she's doing fine. Now I'm going to put the transparent dressing on, making sure that we can visualize the catheter's insertion site. Almost finished, Miss Cooper. Okay. I will now place the patient to be more comfortable. Make sure I can see the area and apply my label with the date, the time, and my initials that I changed it. How you doing, Miss Cooper? Great, good to hear. I'm going to place the patient in a comfortable position and put the bed down. Remove my gloves. Perform hand hygiene. And label the catheter dressing. Changed. Date, time, and initials. Right there where we can see it. All right, here's your call bell, right here on the side rail. Give a call if you need anything, all right? Patient verbalized understanding. Now I'm going to go to the chart and document my actions. The end.